Welcome to IVC. We look forward to helping you live as healthy and active of a lifestyle as possible. Our team is committed to providing you with state-of-the-art personalized care. IVC is nationally accredited with board-certified physicians who are fellowship trained in vascular and interventional radiology. Interventional radiologists are on the cutting edge of clinical advances and use the latest image-guided technologies in the treatment of many medical conditions that once required open surgery. Their expertise includes management of arterial and venous disease, including peripheral arterial disease, varicose veins, blood clots, and other vascular disorders. You will also work closely with our experienced nurse practitioners, nurses, physician assistants, specialized sonographers, medical assistants, and office staff. IVC is committed to helping you through each step of your care, and we want you to be as informed as possible about your conditions. We hope this video will provide you with important additional information to help you understand varicocele diagnosis and treatment. What is a varicocele? Varicoceles are an important but often unrecognized cause of chronic groin or scrotal pain. Varicoceles are also associated with infertility. To explain varicoceles, it helps to understand the purpose of veins in the body. Veins return blood to the heart. Many veins have valves designed to help return blood to the heart by preventing backflow of blood in the vein. When these valves don't work or deeper veins are obstructed, blood pools in the congested scrotal veins, resulting in vein distension and increased pressure in the scrotum, which may cause chronic scrotal pain. Varicoceles are also a common cause of low sperm production and decreased sperm quality, which can cause infertility. What are the symptoms of a varicocele? Men suffering from a varicocele most often describe scrotal heaviness and pain that is worsened by prolonged standing and heavy lifting. Pain may be sharp or dull. Increased pain with standing or physical exertion. Pain worsens over the course of a day. Symptoms relieved when you lay down. May cause impaired fertility. How are varicoceles diagnosed? Unfortunately, symptomatic scrotal varicoceles often go unrecognized and untreated. The diagnosis is confirmed with duplex ultrasound. Because there are other potential causes of chronic groin and scrotal pain, it is important to exclude other causes of pain, such as hernia or a testicular mass. How are varicoceles treated? Once the diagnosis of varicocele is made, this condition can often be successfully treated with a minimally invasive procedure called embolization. The embolization procedure requires little or no downtime and is performed in an outpatient setting. In properly selected patients, embolization provides significant relief of symptoms in over 85% of patients who are treated. Successful treatment is also associated with improved fertility in properly selected patients. Under ultrasound and X-ray guidance, your treating physician will guide a small diameter flexible catheter, or tube, about the size of a strand of spaghetti into the affected testicular veins. Injection of a liquid contrast agent allows the interventional radiologist to visualize the abnormal refluxing testicular veins, and then close these veins using a combination of tiny metal coils and sclerosant. Closing the diseased veins generally relieves the aching scrotal pressure related to the varicocele. After treatment, the catheter is removed and a small dressing is applied. Patients typically return to normal activity the same day following the procedure. The advantages of embolization include little or no downtime required, performed as an outpatient procedure, minimally invasive but highly effective, short recovery period. Here are a few treatment tips to keep in mind as you prepare for your embolization procedure. Wear comfortable clothing to the procedure. Eat a light meal the evening before your procedure. Don't eat or drink anything 6 hours before treatment unless directed by your doctor. Over-the-counter pain medication is typically all that is needed after the procedure. While recovering, stay active but avoid heavy lifting. Reach out to your treating doctor with any questions or concerns. Associated treatment risks. As with any medical procedure, and in spite of our efforts to keep you safe, there are known potential associated risks with varicocele treatment. Although uncommon, These risks include infection, bleeding, deep and superficial vein blood clot formation, coil migration, and persistent or worsening symptoms. Infection risk is minimized by our use of strict sterile techniques. You will be instructed to keep the vein access sites clean and dry for several days after your procedure to prevent infection and scarring. Antibiotics may be prescribed in select cases to further reduce infection risk. Please let us know if you have undergone heart valve or joint replacement surgery, or if you have other conditions that may require pre-treatment antibiotics. Bleeding is usually minimal and can typically be controlled by applying local pressure. If you are taking a blood thinner for another condition, we will typically have you stay on it during treatment. Please let us know if you are taking any blood thinners, including aspirin. The risk of developing deep vein blood clots in legs, DVT, or lungs, PE, is less than 1% for most patients. DVT and PE risk is higher if you have a history of previous DVT, PE, or if you have a known blood clotting disorder. Please let us know if any of these situations apply to you. Stroke is a rare potential complication of venous embolization. Although a permanent neurological deficit would be extremely unusual, patients may infrequently describe transient headaches and visual changes that typically resolve within a few minutes. Please let us know if you have a history of migraines, stroke, or cardiac defects, such as a patent foraminovaly, as these conditions may be associated with increased risk of stroke. Coil migration is rare. We take precautions to size the coils for optimal stability and effectiveness, and they are used to occlude the diseased veins. And finally, in spite of undergoing a technically successful procedure, your symptoms may persist, reoccur, or even worsen. For most patients, however, the benefits of treatment outweigh the potential risks. Please let us know if you have any other questions regarding the potential risks of varicocele treatment. Conclusion. Scrotal varicoceles can impair your lifestyle, contribute to infertility, and can cause significant discomfort. With the help of our team of vascular and interventional specialists and state-of-the-art diagnostic and treatment tools, patients can generally achieve significant relief of symptoms and improved fertility. While we cannot alter many of the risk factors that may predispose you to developing a varicocele, we'll do our best to help you manage your condition. You'll have time to consult with us in greater detail before any procedure we perform. If you have questions or concerns, or if you experience a complication following a procedure, we want to hear from you as soon as possible. Our providers are on call 24 hours a day and can be reached after hours through our office number at 801-379-6700. If you'd like more information about your specific treatment process, visit ivein.com or ask one of our providers. We hope this video has helped you better understand varicoceles and the associated risks and benefits of treatment. If you have questions or concerns at any time, please ask one of our providers or office staff members. We look forward to working with you.